On Mondays, we like to visit mental health and me, and today we're talking about disparities that face our Black community. Here to provide some perspective is race and equity expert Dr. Rosemarie Allen, and we were just talking about these numbers in this year and how hard it's been on everyone. When it comes to mental health and mental illness, there's always been a bit of a stigma in America connected to that and a reluctance to seek help. Is that something that is maybe even stronger in the Black community?
Oh, absolutely it is. You know, the African American community, we have a very complicated relationship with the medical profession. And this stems from decades of medical mistrust, of medical experimentation, abuse, and pretty much substandard care. You know, there was even a time in our society when there was a belief that Black people didn't have the capacity to become mentally ill. Then, after the Civil War, there was eugenics, and African American people who were deemed mentally ill were forcibly sterilized, subjected to lobotomies, and overall institutionalized. So it's been very complicated, and there is a long history of mistrust.
And since it is so complicated, the idea of trying to repair it, especially in the throes of a pandemic, it becomes, I wouldn't say more complicated, but probably far more difficult.
Oh, absolutely. It's far more difficult. And there are long-term ramifications. Right now, we know that the African American community is not being vaccinated at the levels that we'd like to see. It takes a lot of trust in order to really engage with the medical profession. And some of the long-term impacts that we're seeing is, for instance, we have an increase in the number of suicides for young children between the ages of 5 and 11. Over the past decade, those suicide rates have gone up, while at the same time, white children the same age, their suicide rates have gone down, and now African American children's suicide rates are double. And then we also know that about 20% of African Americans will have serious psychological issues, but are a lot less likely to seek help from a medical professional.
Well, talking about it certainly does help, but sometimes talk is just that. And what can people do, or what can we as a society do to help change that narrative, to try to repair the problem?
You know, one of the things we have to do is build trust. And one of the ways we do that is to increase access, affordability, and awareness of mental health. And then we have to increase the numbers of therapists of color, specifically Black therapists, that Black people can go to, who will understand their uniqueness and understand the impact of historical and generational and racial trauma that has existed for years.
And is that something you see coming? Because when you talk about having more Black therapists, that's years of education. Is this wave already starting?
It is starting, and actually I'm very proud to say my own daughter, Jasmine Crane, is a therapist. And there's an association, the Colorado Association of Black Psychologists and Psychiatrists, that people can go to. And we are seeing an upward trend. It takes a while, but I do believe that we will get there.
Well, it's a conversation that will continue and hopefully is helping as well. Dr. Rosemarie Allen, it's been a pleasure. Thanks.
Thank you so much for having me.
All right, we'll be right back.